Hello, everyone. Thank you so much for joining us for our third science talk of 2026. My name is Dr. Miriam Axel. I am stepping in for our host for this series, Dr. Rohit Ramchandani. Delighted to welcome you and would like to let you know that our entire 2025 as well as our 2024 series is available online at our website. That's unu.edu/science-talks. Today's talk, like all others, will conclude with an interactive question and answer session at the end. So please feel free to put your questions to our speaker in the Q&A box or in the chat, and I'll be sure to share them. The talk will also be recorded, and the recording will be available after the session. And now it is my great honor and pleasure to introduce today's speaker, Dr. Wasim Ahmed, who is an associate professor in marketing at Hull University's Business School and also a research fellow in social network science and digital disinformation at UNU-INWEH. He's a leading expert in social network analysis, data visualization, and digital disinformation. His research uncovers the mechanisms by which false narratives around public health propagate and shape public discourse, which we'll be talking about today. Dr. Ahmed's work has been featured in worldwide media and attracted widespread citation and recognition, primarily for his use of social network analysis, or SNA. Dr. Ahmed has authored over 50 peer-reviewed academic journal articles and has received international media recognition. It is a great honor and pleasure to welcome you to the UNU-INWEH team, Dr. Ahmed, and to have you as a speaker today. Thank you so much. Now, without further ado, I'll turn it over to you.
Great, perfect. Thanks so much for that introduction, and hopefully you can see the slides and everything. So this talk is around the research that we've been doing over the last 5 to 6 years, mostly after the COVID-19 pandemic. We were interested in online networks and especially disinformation. So I'm currently based at the University of Hull in the business school, but my PhD was in health department, where I was interested in doing a thematic analysis of how people spoke about infectious disease outbreaks, things like Ebola, the Zika virus, and the H1N1 swine flu virus as well. That's where I kind of got an interest in health, and some of these methods, network analysis, and some of the future work we've been doing. There's also an element that's been of interest to business schools as well. And most recently, really happy to be collaborating with UNU as well around a network analysis. I am also a part of the Social Media Research Foundation, which maintains some network analysis resources and tools as well. One of the tools I'll be speaking about today as well is by the Social Media Research Foundation. It's a wide network, so I'm part of this network with other colleagues, and the goal is to run events on network analysis, develop tools, and kind of help other academics and researchers be able to retrieve and analyze data. And some of the methodologies and tools I'll be referring to are directly from the Social Media Research Foundation as well. One of the key events over the last 10 to 15 years has been the wide range of new social media platforms and vast amounts of data that these platforms have been generating. So initially the likes of Facebook, but more recently TikTok, Threads, and X have exploded, and there's all this data being generated. Some of this can contain disinformation, misinformation. Some of it can be used for positive messaging, trying to get public health messages out there and outreach, which I'll be speaking about. One challenge for academics has been to analyze this data in scale for researchers to actually understand what harmful narratives are being shared, what are some of the positive aspects being shared as well. And our research tries to kind of uncover some of these patterns by drawing upon social network analysis and just trying to understand what people are saying who's spreading certain narratives, and who's influential within these networks. Year on year, there's different organizations. So this is We Are Social and Meltwater. They try to estimate the global number of internet users, global number of social media users. And there's lots of different organizations and companies trying to predict and estimate how many people are on social media, how many people are on the internet compared to the kind of overall population. A lot of them, there may be some differences, but one thing they tend to be reporting over the last 5 to 10 years is that there is an uptick in the number of people active on social media and active on the internet. And year on year, there's a percentage increases in individuals accessing the internet, accessing mobile devices, mobile phones. The reason this is important from our research perspective is that often some of the social media platforms we're studying, even though they may have, say, for example, 300 million users, because those posts are getting indexed across the web in news articles, shared in forums and other places, the actual reach for those is much bigger than just those platforms alone, because they're often reported in press. And with mobile phone subscriptions and for mobile phone users increasing as well, you've got rapid cascading of disinformation around health and other initiatives rapidly being spread around in a matter of minutes, kind of all around the world. And this is tending to increase as more people connected, more people active on social media, and it kind of increasing the amount of data that's available to kind of analyze as well. And you might have seen variations of this internet minute infographics around the web as well. So this just showcases that in a single minute, there's millions of data points being generated now. 167 million videos watched on TikTok, 2 million Snapchats, as vast amounts of content being generated. And from a kind of public health perspective, from health monitoring, it's really hard to actually understand what's happening. A lot of these platforms are quite guarded with their data, so we don't know how they're impacting or how people are becoming convinced on, say, certain conspiracies or disinformation around the web based on all of this information. That's where network analysis comes in, where we can now take data from these different platforms, and then we can try and use graph theory and concepts from sociology to visualize and understand mathematically which users are most influential in these networks. So we can answer questions like who is the most influential user in a network? What are key communities and hubs that form around these topics? And then we can also start looking at web URLs and find out who are the most influential people and look at those information sources as well. So we can go from our kind of tabular text-based data and look at the relationships between different users, different entities, and start to identify patterns. And one of the key benefits of these tools are that we can start to do this in scale as well. So we can take a representative subsample of a large data set and try to understand what narratives are being shared. In some tools that I'll speak about, you can actually directly bring in millions of posts and start to understand these patterns and find out what information is being propagated, where is it coming from, and we can do this in a quite visual way. So this is one example of a kind of simple network visualization. Within popular culture, if anyone's seen the TV series The Simpsons, this was a viral infographic that was spreading on Reddit, where users had done a network analysis of the character interactions from The Simpsons. So I've been using this in some of the classes I've been teaching just to show a simple example of network analysis and how it can uncover certain patterns within the data. So you have a, the script, so they can take the TV show, they can look at the script, and then they can look at what character engages or speaks to other characters the most. And then these stronger, darker connections reveal stronger relationships between different entities. So, for example, you have Homer Simpson connected really strongly to Mo Sizlak, and in this show, he's the bartender. Homer's frequently visiting the bar, so we can see a massive connection there. other entities that are linked. So Bart Simpson is best friend, Milhouse's, and they've got a really strong connection with each other. Ned Flanders, Homer Simpson. So in this simple example, we can easily see, okay, there's colleagues who are connected. They go to the same school. They're connected, and it's trying to kind of show some shape. And then if we want to take this further and say actually which person could end up connecting others, which user is influential, which person is influential more than others, in what context, we can actually then take the same method and apply this to scale to some of the large networks on social media, where it's not as easy to see these patterns, where you've got thousands, millions of interactions, and then start to understand central users, central nodes within there as well. And there's a lot of different centrality algorithms to think about who is it that's influential in these networks. One of the powerful ones, between essentiality, is really useful for the social media context, because often you might find a user and they might not necessarily have a huge amount of followers, but because they were in a strategic place within that network, for example, they have 5 or 6 followers themselves that have a million people following them, and they are often retweeting their posts. We would say that this person is in a quite important place in the network. And you have other algorithms, network centrality metrics, things like degree centrality, which just looks at how many connections does a person have. So in an organization, could be which person speaks to others the most. Whereas with the betweenness centrality is what additional resources can this person bring in. Later on, I've got some examples from kind of people analytics and HR as well, of how we can use some of these methods and apply them to in-person networks as well. There's all various popular culture mentions popping up now as well. So a lot of American TV series, TV shows. So another example, Homeland, season 7, episode 6. So I was casually watching this TV show, and they actually within the show pull up a network analysis. So they go to some IT experts, and they're trying to find out that some disinformation is being spread. And in the TV show, they actually start to show a rudimentary form of network analysis, where they start to look at bots as well. So within the mainstream media as well, so network analysis has been catching on. There's popular culture mentions there. Another TV show, The Wire, season 3, episode 7. They show the use of network analysis for intelligence, intelligence, and law enforcement as well. So you have a mobile device, you have a drug dealer kind of operating at large, and his employees on the streets are often calling him. And then when we do a network analysis, we can actually see all of the inbound calls coming in there as well. And this was a TV show from quite a few years ago now, and still within a kind of popular culture, crime detection, you've got the ability for network analysis to come in and provide those insights and patterns. One of the easiest tools that I've found to actually do network analysis, and there's other open source tools I'll speak about, like Gephi, but one tool that we've been using, NodeXL Pro, we were particularly drawn to because it actually comes as a Microsoft Excel plugin. So within the familiar Excel package, I download NodeXL Pro, and it's kind of appeared on the screen. I can start to import data and kind of visualize it, and kind of look at the different patterns and networks. It is a paid tool, heavily discounted for students. So when I was studying, I think I was paying $40, and I had it for the year. But there are open source ways to do network analysis, so you can use tools like, for example, Gephi, again, user interface, but also some programming packages as well, I believe, in R. They can do network analysis, potentially also in Python. You can actually do those for free, bring in network data and visualize and analyze that as well. And there's many other graphical user interface based tools as well. With this example here, NodeXL Pro, we can bring in data into our spreadsheet format. Typically with this tool, we would look at, say, a sample of 20,000 tweets at a time, social media posts. We can go to other platforms as well to bring in that data. And we're able to get that data. We can do text analysis, sentiment analysis, and make visualizations as well. So some of the research I'll speak about a little bit later, it was performed using Node XL Pro, and in some papers were also done in Gephi as well, using those visualization tools. We can bring in data, we can analyze the text, we can do sentiment analysis, we can do time series analysis, top contents analysis as well. If anyone is interested in Node XL Pro, we're often running events and things as well. If you drop me a message, we can organize registration for those as well. We also have a tool that we use called Gephi, which takes our network analysis visualizations and makes these different types of visualizations. So these different tools have different algorithms and different ways of laying out the patterns and the data and different visual elements. And you can take data from one platform and turn it into another as well. So this tool, Gephi, some find it more visual, more aesthetic as well. So you can go and make different types of visuals. You can kind of zoom in, you can zoom out of the network, and you can actually see the engagement between different users, and you can actually export and go from one tool to the other. One other tool that might be of interest, which is available for free, called ZHumor, allows you to actually bring in data from different platforms like TikTok, Instagram, LinkedIn, Threads, for example, and actually get those. So you log in, it's a Mozilla Firefox plugin. You install this tool, you go to the likes of TikTok, Instagram, X, and it will browse on your behalf, and then it will get that data and save it, and you can kind of analyze it for insight. And Node XL Pro, if you want to do network analysis, Node XL Pro by default has access to the X importer, but not other platforms. But through this tool, you can actually export your data in a format known as JSON, and then we can actually bring that and do network analysis, even of TikTok, of Instagram, of Threads, and we can start to understand network patterns across those platforms as well, and kind of gain an insight into it. In terms of kind of shifting to some of the research we've been doing using these tools, a couple of years ago now, there was a lot of studies, a lot of research thinking and talking about how false news might travel faster than true news stories across social media platforms. So fake news, disinformation is often quite emotive, and is often quite strange as well. Some of the conspiracies being shared, and then people are more receptive to kind of sharing it, and it often does kind of cascade and spread around further. And what the Social Media Research Foundation have done in collaboration with the Pew Internet Research Center, they sat down and they looked at thousands of at the time, Twitter networks, discussions, conversations on certain hashtags, kind of topics, politics, all sorts of different conspiracies, general topics. And what they found was these conversations tended to reflect certain patterns. Each time they looked at a different network, a different visualization, they kept finding that actually there's some patterns in this data. There are things happening in certain discourses in the online world that they could actually theorize and put out there. So what they found was that sometimes on social media you'll have this concept known as a polarized crowd, and especially during elections you'll see this quite a lot. So in the recent US election, if you were to actually get a topic, a hashtag, you'll often find there's these two clusters that are there, but they're not speaking to each other. And what we'd see if we visualize this is in this example towards the bottom is two groups, massive groups of users speaking, but they're speaking about different things and they're not connected to each other at all. And other patterns they found were things like a tight crowd. So often in conferences, shared hashtag, most people will know each other. There's overlap. There's kind of people speaking to each other in there as well. You've got other shapes as well, things like a broadcast network, one or two people just amplifying the content. And a lot of the conspiracies were kind of the broadcast shapes as well. So what we would do is we would go away, we would think about a conspiracy, a network that's spreading. We would retrieve data on that specific conspiracy, and we'd analyze the network, kind of especially reflecting back to this report, and think about what we're seeing in that network is, are users being amplified, people quite polarized, and one network structure, one network shape can have elements of broadcast. It could have a polarized element. Could also have some users kind of tightly connected as well. And then we would kind of come up with interpretations in there as well. With some discussions, people just posting and not engaging with each other, and there's ways to kind of interpret those as well. So you've got elements of broadcast, people being amplified. You've got this polarization occurring as well. One of the major studies that we did back in 2020, using this network analysis, and I just come into my kind of first academic post out of the back of my thesis, which was on infectious disease outbreaks, and then straight after there was the COVID-19 pandemic. So I was quite well versed in network analysis, in analyzing infectious disease outbreaks. So I thought this conspiracy that was around at the time might make an interesting research paper. And this conspiracy was spreading across the UK and Europe, and it was that the 5G conspiracy theory was that the 5G telecommunications network, so you had 4G and then now 5G, so faster kind of internet speeds, download speeds. They were rolling this out across the UK. They were setting up phone masts, as they call them, kind of towers with these kind of aerials and phone networks around the UK and across Europe as well. And somehow social media users started to link this first to say that 5G is weakening people's immune systems, and then further on they said that it was actually causing the whole pandemic, and it was a kind of cascading that spread as well. And there are some people that'll still believe this, so that there's no scientific basis, there's no kind of peer-reviewed research that's kind of stood up to time to say that 5G was responsible for the pandemic. But there are some people who still believe this, and they can get quite kind of argumentative as well. So I've come across people, and they will still quite adamant here as well. And the reason why this particular conspiracy was key to study is in the UK, there was a lot of arson attacks to 5G phone towers. Even a hospital, I believe it was around Birmingham, was vandalized because people had seen things on social media, particularly on X. And unfortunately, one person was jailed in Newcastle as well, because they'd claimed that they'd seen this stuff on social media. They actually believed it, and then they kind of went and kind of vandalized 5G phone towers, and across Europe as well. And they also went further, so people were being abused, telecom workers as well, setting up these towers. And one of the bosses in the UK, a kind of telecommunications company, came out and said this has to stop. That is, people on the job kind of being abused, setting up these towers as well. So we studied this. So we published a paper in May 2020 using network analysis to analyze these conspiracy theories. And we were able to get a week's worth of data when this was trending in the UK, where it had quite a lot of impact, and actually do a network analysis of this paper, and then also consequently appear across the media as well, policy sources, and just try and raise awareness within the media of this conspiracy as well. Why network analysis was helpful in this instance is when you see something visually, you can straight away see actually these were the key groups, and then you can see the impact that these were having within the network as well. So we found that there was a broadcast group where 4 or 5 users were just amplifying content, quite harmful content at the time. And then we found that there was an activism account, an account that was set up just to spread the conspiracy. So there were videos of 5G phone masts and towers being set on fire, and then users kind of saying which ones should be targeted next. So they were almost kind of planning and kind of taking joy in all of these things that were happening on social media. And we were able to find out those clusters, those patterns that were actually responsible for spreading the conspiracy the most, and which users were just kind of posting it and sharing general comments in there as well. And then with these tools, we also get an insight into what users were most influential as well. So you've got ordinary citizens becoming influential. And then what we start to see is a dedicated 5G COVID-19 account set just to spread out the conspiracy. Not massive followers, 383, but really active, really high betweenness, centrality, and lots of ordinary users just trying to kind of spread that conspiracy. Interestingly, in all these networks, Donald Trump would get pulled into them just because he was being tagged, not necessarily posting. He was often tagged or kind of mentioned as a kind of authority figure, as well as YouTube as well, who didn't post on this. But a lot of YouTube videos hosted this data, and by being mentioned quite frequently, they become involved in that network as well. Such that if they did post, they would have quite a lot of power over the network as well. We also found dubious websites, things like InfoWars, spreading conspiracies as well. There were some websites out for monetary gain as well, so they were selling or claiming to sell electoral protection as well. So there was a couple of companies, Rayguard, for example, had all sorts of equipment trying to protect against 5G, and they were posting things for a financial gain, and people across YouTube as well. And these tools give you those websites and URLs as well. And then we can follow this up. We did a manual kind of thematic analysis. We found out what key posts people were sharing, what percentage of people actually believe this conspiracy, and how many were just kind of joking around as well. And there was a real mix. So 30% of users just found the whole thing humorous, and they just couldn't believe anyone would hold these views. But then there was another 34% that actually were quite adamant that this was legitimate, and they were kind of raise awareness of this as well. Some of the tweets that, in hindsight, these platforms should have taken down a little bit faster were stuff around inciting more 5G, 5 masts to kind of go down, people sharing videos of towers burning and planning what should be done with others as well. Ultimately, uh, Twitter at the time did catch on to this, and they just wiped some of these posts out. But it wasn't for a while afterwards. So this was happening. People were planning things. It was kind of unfiltered. There was no kind of moderation of this. It was occurring. People were believing this, getting thousands, millions of views across the internet before ultimately this got kind of taken down. And if we look at the domains, YouTube also a little bit complicit through the videos they were hosting at the time as well around disinformation. People claiming to be medical professionals sharing conspiracies and posts on there as well. So that was the COVID-19 conspiracy. And COVID-19, it brought out a wide variety of other conspiracies as well. And one that was more international, a bit more exposure globally, was this hashtag Film Your Hospital. And this also connected into a little bit of what was happening in the US around the policies and politics as well. So Donald Trump was kind of against some of the lockdowns, and his supporters were as well. So this became again a trending hashtag internationally, and the goal here was for the conspiracy theorists to send people to their local hospitals to film them, to prove and show that they were empty. And there was massive amplification in these networks as well. A lot of people retweeting, a lot more influencers with big followers involved in this as well. And the unfortunate outcome were kind of nurses, doctors on their breaks were kind of being filmed, spoken at in unpleasant ways, and people actually going and doing this as well, for kind of posting it on TikTok, posting it on X and other platforms as well. One question that kept coming up with our research on COVID was how many of these accounts are posting who are real? Could this be kind of bots? Could it be automated accounts? And we did use one tool, Botometer, that looks at how much an account posts and whether we can find anything in the volume of that post in how much they're posting in a certain amount of time to indicate that this could be a suspicious or bot level account. We found that actually there's very low probability, so only 2.2% of the sample resemble highly suspicious account behavior. And of that kind of the manual verification we also did looking at those accounts during COVID, it does look like a lot of the cascading and sharing and development of these accounts were not really driven by automated accounts. It was individual influencers and ordinary kind of citizens and users amplifying that with a small level of automated accounts and bots with some amplification in there as well. What we did later on, so we've been looking at these different conspiracies, and then later on in 2023, we brought all of these different networks together and paired them with a couple of other conspiracies at the time. So there's this idea that 5G is weakening people's immune systems. There's the Fermi Hospital conspiracy, and then others, the Bill Gates microchip conspiracy, hashtag expose Bill Gates, and then the viral video, the kind of pandemic conspiracy. So a lot of people had these lockdowns. People were on social media, and there was all these different kind of conspiracies occurring. So we went and we gathered data in all of these different networks, and we're able to look at the number of users in those, percentage of tweets that are retweets, and just understand what's happening in these networks. So one pattern we detected was that most of them are amplifications. So ranging from 39 to 56% of people are retweeting these posts. So they're trying to amplify them across social media. And another pattern we found that often none of these networks were actually sharing links to any credible information. Say compared to a more scientific debate, it was dubious websites, dubious information sources, people broadcasting these networks with false claims in them as well. And often with amplification, if one user kind of retweets it to their network, then their followers were often retweeting it, and this was giving it the kind of viral reach. So you have the network filled with these smaller groups of users, one influencer retweeting another influencer, and it cascading, and then ordinary people just seeing it loaded on their feeds. Then the algorithms kick in, and then the topic starts trending. Kind of mainstream media starts seeing it, and it was kind of seeded strategically from a few accounts at the bottom. So within these network analysis tools, you can do these different comparisons, and all these clusters we're showing is what I showed in the simpler form. You've got users posting and then it taking a life of its own in those other clusters, other groups as well. And we looked at and commented on all these different conspiracies across these different network shapes and patterns as well. And then we tried to come up with some high level um, kind of theoretical elements of what we thought was happening. So you've got a strategic seeding, you've got low impact technique, you've got some users coming together on some controversial topics. So with the 5G conspiracy, it just started off as, oh, maybe this is doing something. And then people start to use their followers, start tagging people. And then there's a group kind of forming, speaking about this. And then people start to add their own personal views and start to convert this into a fully fledged conspiracy, and then they start to augment it as well. So it gets further. In the UK, the 5G conspiracy kind of followed this template. Some users seeded it, they started to develop it, and it got packaged up into a fully fledged conspiracy. And then at the augmentation phase, the mainstream media, even TV show hosts as well. So one TV show host was widely condemned and criticized on UK television, started to speak about the 5G COVID conspiracy as well. Celebrities engage with the influencers as well. And then at the end stage, all of them, all of the different conspiracies started to be brought into the kind of politics area as well, and ideology as well, and a lot of political point scoring as well, using some of these conspiracies and actors being brought in. So we see Donald Trump almost in all of these networks being brought in somehow to justify things or for criticism as well. So that was wide range of research that we've been doing, and network analysis is really key in all of this, bringing in that data, being able to understand who's influential, the patterns, the things they're sharing, and to understand who was kind of spreading it, and then we can come up with techniques, tactics. How can we kind of overcome this disinformation? And we have done some research looking at the positive side of these influencers, sharing kind of anti-narratives quickly and rapidly. And those are some of the recommendations in our papers as well. Some strategies that influencers or organizations could collaborate with to kind of share kind of reasonable content to kind of counteract some of the extreme views being shared. One or two other lines of research we also worked on were more exploratory, to look at the relationships between what happens on social media platforms and networks around the world, and whether that reflects events happening on the ground here as well. So in one exploratory paper, we were just interested to see actually if we take, so this is a network visualization in Gephi related to mandatory vaccinations in Poland, where there was disagreement between social media users or whether they should make vaccinations mandatory for COVID-19 or whether they shouldn't be. And in this grouping, we've done two clusters. So in dark green, it's the vaccination mandate advocates, and in dark pink, it's the kind of mandate opponents. And we see this as a polarized discussion where two groups, big groups of users, are against each other, but they're not really connected. They are speaking amongst themselves. When we do this type of network analysis, what we were able to then do is, if we look at these two clusters and how much they're tweeting, how much they're replying and posting, we actually saw correlations on the ground. So what was actually happening? So if there were new cases, if there were more deaths, we saw the number of replies, number of tweets, all of those things occurring as well. So there were patterns in what's actually happening online, reflecting what was happening in the real world as well. And there was some interesting overlaps as well. And then we were hoping to kind of use this and build for future research as well, more from that kind of prediction element as well. But it was interesting to see how these two um, patterns, these two networks could actually be brought together as well. And there was early research on Twitter as well, things around flood detection, flood risks, and then early warning systems as well. And even during COVID, there's been a lot of research around comparing what's actually happening online compared to the kind of other types of data as well, kind of cross comparison. So I've spoken a lot about using social network analysis for disinformation, public health conspiracies, but there are also positive health messaging and strategies that network analysis can be really useful for. And we've done written papers on doing network analysis of things like vaccines work hashtag, where we looked at who kind of spreads those topics, and hashtags around magnetic vaccines, where influencers came in and just disrupted the network so that the conspiracies weren't able to spread. One line of research we've been recently doing, this is based off of the needs in the UK. So the NHS, Blood and Transplant, National Health Service, and other organizations have been really struggling with a lack of people on the organ donation list. And sadly, people each year not being able to actually get an organ. So children and adults on waiting on the list, ultimately not getting it, and sadly passing away. And this is particularly been a big issue in ethnic minorities in the local region as well, where there's just not enough people on the donation list. So we're really interested to find out what's happening on platforms like X around these discussions, because one factor has been health misinformation and disinformation as well. So people feel that if they do sign up, that if they are ill or something goes wrong, that medical professionals may intentionally kind of speed up their deaths to kind of harvest their organs. TV shows like Squid Game as well have been showing kind of organ harvesting, and there's a lot of myth and conspiracy around this as well. So network analysis, we can go into a lot of different topics, and in this case, we're able to get 30,000 posts over a 7-month period. So there are a lot of people speaking about this, and then we can start to develop frameworks. So we came up with the Org Reach social media marketing strategy, and we pushed out recommendations for how these health organizations can create content, collaborate, analyze, and then respond and kind of reevaluate what types of content they're actually sharing. So there was a sizable conversation actually occurring on X. 20,000 users had actually posted 33,000 posts in just 7 months. And interestingly, we found that, so this was anyone in the world, so this is global post, and it was actually the NHS organ donation account that was the most influential in the whole world in terms of kind of raising awareness and getting the reach out there. So they have an account, their user bio is around kind of saving and improving lives, and the official account. The next most influential account, interestingly, came from the office of the Prime Minister of India, who had got a dedicated webpage and had been doing quite a lot of outreach as well around organ donation as well. And then the third most influential was the Prime Minister of Canada in terms of some of the work they'd been doing. And then we had a wide range of other accounts in there as well. So people who'd actually received a transplant have now become influencers and citizens and other users as well. And we did find that there was not much interaction between these different clusters and accounts. People are kind of promoting it, but they're doing it in their own, say, countries, our own groups and own communities. So there's not that much cross interaction or cross discussion in there as well. So we, in our marketing strategy, we try to come up with the ability for them not only to create content, but if they collaborate, if they connect and curate together, this actually could cascade this network. This could be much bigger, and you could actually get a much larger reach as well. So this is one area we've been really interested in. We've been collaborating a lot with the UK major organ donation charities, with the NHS as well. So uh, we ran a research sandpit. We had local nurses from the hospital involved. We brought all the charities, and we tried to understand what is the kind of disinformation around this. What we do for kind of community outreach on social media as well. Just a couple of final slides. So we did recently also publish a book on how you can use social network analysis to analyze disinformation as well. And it was with my colleague, Professor Marion Hardy from Durham University. And we speak about disinformation networks from a kind of sociological perspective, and understanding then how we can map it as well. So what is a network analysis? What are the algorithms and methods we can apply? What layout algorithms should we use? And then also how we can use network analysis to identify AI-driven disinformation as well, and what is the kind of future implications in there as well. In terms of the wider research I've been mentioning, you'll find in the slides as well, which I've shared, there's some links in there as well. So we've looked at a wide variety of different topics, either using network analysis or doing kind of thematic analysis. So we've got topics on hashtags such as neurodiversity. We've looked at specific health impacts as well, so impacts on nurses during the pandemic as well, conspiracies around kind of vaccines, specific issues around medical professionals kind of sharing information online as well, and specific hashtags for sharing research and the kind of impact that it can have more generally as well. If anyone's interested in just the general method of network analysis and learning more, this book on the left-hand side, Social Network Analysis by Sage, is really good to give you an insight into it as well. And then the book on the right-hand side from 1994 is a really solid, one of the key kind of textbooks in this area, really influential, widely cited, and they do an amazing job in explaining network analysis. Some chapters are quite mathematical, but the other non-maths-based chapters are really, really insightful and useful. And it's a kind of standout text that I would highly recommend as well. One final comment to make, and you'll see this in these books as well, is that I spoke a lot about network analysis from the perspective of kind of social media data, because that's one of the areas that I work in. But network analysis can also be applied within organizations as well, and management consultants in kind of the late 1990s had been developing tools to actually do network analysis of in-person networks. So in this example here on the right-hand side, if we take an org chart, a kind of organizational chart, sorry, on the left-hand side is this traditional organizational chart. You've got a hierarchy, so you've got senior vice president, you've got a lower level, and then you've got a level below that as well. And for example, say you've got a colleague, Mitchell, within the traditional organizational chart, you'll see him quite towards the bottom of the hierarchy list. If we actually then disseminate a survey to this organization and ask them very simple questions like, who do you speak to when you get stuck on this project? Who do you go for information? Who do you connect with or collaborate the most? And people respond to that questionnaire. We can then take this and actually do a network analysis. And sometimes within organizations, it turns out that actually people who you might not realize are some of the most influential people in that organization, such that if they were to leave or depart, there would be serious bottlenecks in that organization where people won't be able to speak to each other or kind of network. They can also identify people who are isolated or not involved in these communities or kind of at risk if they're not integrated or not kind of communicating or speaking to other people. So with network analysis, any two entities that will have a relationship with each other, you can actually map and visualize, be it in-person networks, social media networks, world kind of trade, organizational analysis of different groups, charities kind of speaking to each other. So all sorts of different topics. If you can actually show that there's any links or relationships between entities, the scope for kind of public health research is quite broad as well. So there's a wide range of disciplines looking at network analysis, even historical network analysis. You can also look at as well classical texts and try to look at those and do a type of network analysis. So I think that was all for my kind of slides and insights into social network analysis from public health perspective, but also looking at it from the kind of positive elements as well.
Thank you so much, Dr. Ahmed. That was a really fascinating presentation, and I think you've all convinced us of the value of social network analysis and the diverse applications. I really appreciate how you shared international examples and made it very universal and also reproducible with a lot of resources that we could use to try it out ourselves. So thank you very much for a really interesting presentation. I guess my first question is, it was really interesting that less than 10% of the misinformation regarding COVID was coming from bots. And I'm wondering, first of all, do you think now that might change with the advent of AI and that being more frequently used? And how can we as concerned citizens identify misinformation that's coming from bots? What are some of the metrics that you use for that?
Yes, really good question. So with we're currently working on a couple of research papers trying to develop metrics to actually see what's happening on those platforms, because we are seeing with the ability for AI to generate content, to generate the videos and cascade those rapidly, a lot of issues in terms of information quality on the platform. So I was reading a couple of weeks ago, maybe 20-30% of the social content is now AI generated. With network analysis, it's still possible to map out those conspiracy networks, so we can identify triggers within the network pattern. So inauthentic content, we can see amplification. So if they're putting out fake posts and there's users around that, we can look at that. We can look at things like account sign-up dates. A wide variety of accounts are just signing up within the last week and they're just sharing this content. We can isolate those users as well, follow accounts as well. We can look at those different patterns in there as well. Um, Once we have that mapped out, sometimes we can also group those users into those different groups, and we might see those isolated clusters as well.
Thank you.
Doctor, and thank you so much for your amazing talk. I'm glad that I could contribute to raising awareness about this useful methodology. So one question that I have is that since the ownership of Twitter, or formerly known as Twitter, now X, has changed, the access to APIs is a little bit more difficult, obviously, compared to before. So, and I, coming from the journalism world, I know that it's been an issue for a lot of journalists who are not necessarily very tech savvy to tackle that problem and access the data on various social media platforms, but particularly X. So, my question is that how do you guys now get the historical data from a platform like X in a way that's not super expensive? Because we know that access to APIs for X is very expensive, and it doesn't necessarily do what we used to be able to do.
Yeah, that's really good question. So with it was quite a big shock when the takeover took place, because pre-takeover, Twitter just launched that academic track API where we can access for the first time for free 10 million tweets a month, which would have cost us millions of pounds. And people are really happy, and that was released. So as soon as Elon Musk took over, I think within a couple of months, they just scrapped that API access, and the platform changed quite a lot. One bypass has been, so NodeXL Pro does an intelligent form of data capture where you actually log in to Twitter with your own user account and profile, and NodeXL Pro opens up an instance of X, and it just searches social media as if you were browsing it, and it will just pull in the posts like that. So not through the API, it will just connect. It just browses through it, and then it will just download those tweets as if you were reading them. The limitations now are that it takes a very long time to actually get and build the data. So before, it might take a couple of minutes to get a 20,000 tweet data set, but now you might need to leave your computer running for maybe a day, 2 days to actually bring in all of those posts to kind of analyze. Similarly with the other platforms as well, through plugins like Zschumer, we can get that data, but using some of these plugins to bring it in. It's quite tricky now for academics to actually get that data through these APIs. We have to kind of go through these other routes.
Thank you.
Oh, and thank you, Dr. Ahmed, for your very useful presentation. And actually, I have a question from your perspective. Maybe it's not the purpose of the presentation or the study you have done, but from your perspective, what would be the policy approach to disrupt the misinformation shared through those platforms? And another thing, how would you be able to navigate the ethical consideration when it comes to vulnerable communities publishing things or publishing disinformation? And how would you be able to assure that the ethical concern is there? Thank you.
Yep. Yeah, no, good questions. But in some of the papers, some of the kind of recommendations we were coming out from were we were not finding there were existing accounts connected to, say, the UK Health Service and other influential bodies, but they were not sharing correct information or the anti kind of narrative. It was really dominated at that time, and there were some people on the fence or not really sure of what was happening. So that was one issue, and another factor was some of the social media companies hadn't invested enough in in-person moderation, and a lot of the posts at the time were violating their own policies, and they ultimately did go back and delete those posts, but they weren't doing it in enough time or speed, such that they were able to spread. And then they did come in and say, actually, all of these posts are violating our own community guidelines, and then they kind of removed those more slowly. X later on has come out with these warning labels on posts as well, which clearly flags kind of disinformation, which is something we were also recommending and suggesting. For that second query, for the vulnerable groups, so we had to be quite careful in a lot of our research. So especially in UK universities are quite strict with ethical approvals and what we're able to publish and show. So in most of our research, if it was an individual citizen or a normal kind of user, we were not publishing the user handles. So in our research, we've anonymized the actual individuals. If they were kind of a couple of hundred followers or not clearly in the public domain, we would often mask their account names, user accounts. Only those users in the public domain already, influencers, celebrities, journalists, those were the accounts that we would actually say these people were instigating these conspiracies.
Yeah, thank you, Mariam. Thank you, Dr. Ahmed. This is a very nice presentation. I have two questions. One is, how we from UNU-INWEH or the scientific community can use this network analysis to not only analyze the misinformation, but also how to propagate or promote scientific accurate information for impact, creation of impact. That's one. Second is, when you want to do propagation of information, there is also algorithms by the social media platforms that heavily influence how far you can reach with your message. And do you also consider that into your analysis? And is there any way to measure that in the process?
Yes, really good questions. With that promotion element, we started to come up with some ideas within our research with stuff around organ donation, but any other kind of health topic. We found that if we go to social media first and we do this network analysis, we then understand who are the key players in these groups, and say the NHS wanted to set up a new account to promote organ donation, they could actually map out the network and then start to collaborate or co-create information and knowledge, tag these accounts, work with those to promote their accounts. Also, it will give us insight into the key websites, key hashtags that the community might be using, or we might be able to also co-create or co-use to get into the general scientific communities as well. For the algorithms, network analysis doesn't directly can give us that insight, but we can try and pair some of the insights with what different algorithms might behave. So on X, if they like to see images, or on LinkedIn, if it was kind of tagging other accounts and users, we can also try and factor that in if we are trying to get into a new community or post content, we'll try and link that into the network analysis through developing the posts we use. But by itself, it doesn't give us those insights into those algorithms.
Thank you so much, Dr. Ahmed, for a really, really interesting and eye-opening talk. We look forward to sharing the resources that you shared with our listeners. Thank you so much to all of those who joined us today. We look forward to welcoming you again next week with our Science Talks host, Dr. Rohit Ramchandani. Thank you very much, and we look forward to seeing you again soon.
Great. Thanks, everyone. Nice to see you. Thanks.